Hey there, my name is Dr. Ahmed, but you might know me as the Aesthetics Doctor. Today, I answered all your questions about tear troughs. Whilst you're here, guys, please give us a thumbs up, subscribe, and drop a little comment. And also, maybe follow all my other social medias. Let's start with what are tear troughs. So tear troughs are the anatomical structures in your under eyes. So normally, people have got a bit of hollowness there, and that creates some shadowing, and it can accentuate the dark circle. So tear troughs filler is injecting really thin dermal fillers in these areas right here to fill them up, make them nice and smooth, reduce the hollowness, and therefore make you look less tired. Anybody is such a broad term here, really. Any medical treatment out there, you need a consultation first. So if you've got pigmentation, if you've got some muscular disorders, bleeding disorders, or other medical conditions, get a consultation first by a medical professional. Surprisingly, not really. So it feels like you're applying a bit of pressure there. So if you just do this, that's exactly how it feels. So we usually use a cannula, which is a blunt tube. With that, there'll be one sharp scratch per side, and then we actually go under the skin, so it's almost completely painless, actually. But sometimes people can come in with a lot of adrenaline going through their system, they're quite scared, but this is where we calm you down, it'll be fine, and it's actually painless. With treatments that involve dermal fillers, you actually see a lot of results more or less instantly. However, post-treatment, you might be a bit bruised, a bit swollen, and that's perfectly normal. So these things will settle within the first 2 to 4 weeks. I always say you see the final results by the 2 to 4 week mark. A general rule of thumb, the less you move the area, the longer your filler will last. So for example, lip filler, you move your lips a lot more than you move your cheeks. So lip filler would last for about 6 months, cheek filler would last for about, say, 18 months or so. So for the under eyes, similarly, we don't move them that much. So actually, it can last for up to 18 months. For me, it's usually actually about 20 months or so. Before treatment, being sensible, not drinking a lot of alcohol in the 24 hours beforehand, just because that can thin your blood a little bit and make you bruise a little bit more. Afterwards, avoiding makeup, alcohol, gym, and wearing glasses for the first few days to couple of weeks. For anyone that's met me in real life, you know I always rave about going to medical professionals only. Because the reality is it's not about being able to perform the procedure, but actually it's all about being able to deal with the complication if something arises. A medical professional, we've been trained for decades to deal with these things. Someone that is not, they haven't. So always go to a doctor, a prescribing nurse, or a dentist. Common things after any treatment that goes through your skin: a bit of swelling, a bit of bruising, and potentially a bit of pain. But that's perfectly normal and usually settles within a few days. If the skin is not cleaned properly, then infections. But the real serious one that we always discuss with our patients, and this usually happens more if you've used a needle rather than a cannula, is blocking a blood vessel. And that's really when you need a proper medical professional here. Because if the filler blocks the blood vessel, A, by being in it, so injected right into the blood vessel, or being around it, so it compresses it, it can block the blood flow to the skin, to the eye, or to whatever medical structure that blood vessel was going to. And that's really when we need to dissolve and see the patient back urgently. Depends on where you go. In my clinics, so in London, Leeds and Cheshire, it's £450 for 1 ml or £650 for 2 ml. And that's obviously divided between your 2 eyes by coming in for a consultation. Even though we say dermal fillers in the under eye area last for up to 18 months, actually in some situations the filler can encapsulate itself, and in these cases it can last for years and years and years. And sadly, the only way of getting rid of it is actually going to a medical professional and dissolving it. If you don't like your results of tear trough filler, because sometimes the product is injected a bit too superficially or in the wrong location, you can get it dissolved. Thank you so much for watching, guys. I hope you enjoyed today's video. If you did, please give us a thumbs up, subscribe, and share the video.